Welcome to AETCM, the emergency medicine channel. Today, let us discuss about carcinoid syndrome. This is a rare condition. Carcinoid syndrome is a rare condition which very rarely come to emergency medicine department. But we have a patient who is having carcinoid syndrome. We'll see what are the clinical findings. Actually, carcinoid syndrome is a paraneoplastic syndrome. Paraneoplastic syndrome means if there is a tumor in our body, it can produce direct effects on our body like compression, bleeding, all these things. But sometimes it can produce some hormones, and that produces some abnormal problem in our body. That is paraneoplastic syndrome. So that is very important. It's actually not direct effect of the tumor. It can be due to some secretions from the tumor. So these paraneoplastic syndrome are mostly produced by neuroendocrine tumors. They are the main reason for this carcinoid syndrome, and these tumors you can mainly see in gut wall, lungs, mediastinum, thymus, liver, pancreas, bronchus, ovaries, prostate. All these areas we can see tumors, but these tumors will produce some hormones. That hormones actually produces all the clinical findings. Sometimes it can be a non-functioning tumor presenting as a tumor or mass. That means that tumor is not producing any hormone, or that hormone is not able to act in the human body. Sometimes what happens, this will become a functioning tumor. That means the hormones can actually produce problems in our body. Now, paraneoplastic syndrome, you can see tumor somewhere in the body that produces clinical findings like it can affect our heart, liver, gastrointestinal tract, respiratory tract, skin. Skin main clinical finding will be on the skin. Many patients who is having paraneoplastic syndrome, they have flushing and redness of the skin. So that will be the major finding. Cutaneous flushing and can have severe itching, all these things. Heart, you can get mainly palpitations. So most of these patients complaining about palpitation may be due to tachycardia or valvular lesion. Valvular lesions are mainly in the pulmonary and tricuspid area. Pulmonary and tricuspid area can have thickening, stenosis, all these things. Endocardial fibrosis can also sometimes produce cardiomyopathies. And liver, you can get hepatomegaly, elevated liver enzymes, all these things. Then another important finding will be diarrhea. Many patients who is having carcinoid syndrome can have diarrhea, abdominal cramps, nausea, vomiting. But diarrhea is the most important clinical finding among gastrointestinal problems. And respiratory tract many patients come with wheezing. Cough, wheezing, dyspnea is the major clinical finding. So three important things we should remember. One is cutaneous flushings, wheezing, and diarrhea. These are three important findings you get. So patient can have flushing of the skin, then wheeze, diarrhea. So these three things looks like allergic reactions. So many patients who present like this, but these patients can have chronic symptoms. That's why they may not come to emergency room, but most of the time they go to OPDs. But acutely they can come with breathlessness, wheezing, and all. Now, when we classify this carcinoid, we have three important classification: foregut carcinoid, midgut carcinoid, and hindgut carcinoids. Since we are talking about the point of view from a physician or emergency medicine person, we will not be going to the pathological features of this type of tumors. But foregut tumors, you can see it is lung, bronchus, stomach, proximal duodenum, pancreas. These are the origins of the tumors, and sometimes it may be due to achlorohydria. Then midgut tumors are mainly originating from the duodenum, jejunum, ileum, and right colon. Hindgut tumors are mainly seen in descending colon and rectum. So that all depends on the from where these carcinoids are originating. But the problem is almost all carcinoids will have similar clinical finding. Sometimes there may not be any clinical finding, they are non-functional. Now, there are a lot of chemicals which can be secreted from these carcinoids. One of the important chemical is serotonin. So serotonin is one important chemical. Then histamine, kallikrein, bradykinin, and prostaglandin E and F. So these are the major chemicals which is released from the tumor. So you take serotonin, it stimulates the intestinal secretion that produces diarrhea. Here also it produces diarrhea, but this is a major problem that produces diarrhea. Okay. Now, secretory diarrhea is very important thing. Patient can have severe diarrhea, but there will not be fever or any other features of infective diarrhea. And it also produces fibrogenesis, leading to the formation of fibrosis, typically cardiac and gastrointestinal fibrosis it can produce. And sometimes tricuspid and pulmonary stenosis also it can be produced. Like next one is histamine. You know that antihistamines we take for itching, flushing and all. So when histamines are activated, you can get flushing and itching. These are the two important findings you get. So remember, diarrhea, itching, flushing. Then third one is palpitations. So another important feature is palpitations. Then bronchoconstriction. So these all are mediated by different chemicals. So chemicals are released from this tumor. So you can get diarrhea. Diarrhea can be due to prostaglandins or serotonins. Histamine produces flushing and itching. Kallikrein, bradykinin can produce a major problem is palpitation. Then flushing due to vasodilatation can occur, and blood pressure can be reduced. BP can be low in some patients. Now you can see here this patient's face, you can see flushing is there. So skin is red, something like SLE you can see here. Here also flushing is there. Flushing is there. So flushing can be the major finding for all patients. And it is mostly commonly seen in small intestinal carcinoid. It's often associated with unpleasant warm feeling, itching, rash, sweating, palpitation, upper body erythema and edema, salivation, diaphoresis, lacrimation. So all the secretions are going to increase in this type of tumors. Patient can have diarrhea. Then next important, so all secretions are increased. Abdominal pain is one important feature. Diarrhea is one important feature. Then rashes and flushing is very important feature. Then facial telangiectasia also can be seen in many patients. So these are the common clinical findings. Now, cardiac involvement we have already seen. Tricuspid regurgitation, that is very important finding because tricuspid regurgitation produces peripheral edema, abdominal edema, that is ascites, hepatomegaly and pulsating liver. All these things you can get. Pulmonary stenosis can be produced by this carcinoid that can produce severe breathlessness in patients. Right ventricular endocardial plaques can be produced leading to heart failure. So ultimately all these findings they are going to produce cardiac failure. So cardiac failure is a major feature due to carcinoid, and it also produces tachycardia. So patient may already have cardiac failure compensated, but the tachycardia during the acute phase can aggravate this problem. So that problem will become life threatening. So that life threatening conditions can be produced by stress and other chemotherapy, all these things. During anesthesia also it can become complicated. Now you can see here neuroendocrine tumors releases 5-HT and other bioactive substances which we have already seen. So that 5-HT can go to heart or other areas. It produces flushing, diarrhea, dyspnea, palpitation, bronchospasm. So patient can come with severe flushing, palpitation, bronchospasm and all. And on examination you can see tachycardia, hypotension, all these things are common finding. Some cardiac murmurs can be there. Fibrosis can be there in mesenteric areas. Sometimes pellagra, neuropsychological disorders, all these things also can be seen in carcinoid syndrome. Now there are a lot of investigations are there, but if you know the diagnosis only, you'll be able to do all these things. In that, one of the important diagnostic test is 24-hour urinary excretion of 5-hydroxyindolin acetic acid. That is one of the most important investigation. So that should be done. Then 24-hour urinary AETCM, that is also should be done. So this is a basic blood investigation. Once you understand about the lesion, you can do this. Other investigation, normally we don't go for the previous blood investigation first itself. We try to do one chest X-ray chest, then CT or MRI. So wherever there is a lesion, we have to take CT or MRI, and depending on the area, we can go for bronchoscopy, colonoscopy, endoscopy, whatever it is. Once you understand there is a lesion in the lungs or abdomen, you can even take a PET scan that will give exact picture of the same thing. And indium 111 pentateroid scan also can be done. Then MIBG test can be done, but all these things cannot be done in emergency room. Normally we take X-ray chest, X-ray abdomen, then CT, MRI. Then if the lesion is in the abdomen, we go for endoscopy, colonoscopy. If it is a lesion in the lungs, bronchoscopy can be done. No, once you diagnose, like any other patient, we have to take care of the airway, breathing, circulation of the patient. Most of these patients come with tachycardia. We have to control the heart rate, hypertension, control the BP. If the patient is having wheeze, normally we give nebulization or oxygen, all these things. So if the lesion is in the lungs, most of these patients can have compressive lesion, and patient can have stridor and wheeze and all. So we have to treat according to the clinical conditions. Now another important drug is uh, somatostatin analog like octreotide. Octreotide can be given for these patients. Initially, it can be given as subcutaneous or IV. Initial 2 weeks, 100 to 600 microgram can be given per day. So that depot preparations can be given even as IM also. So that advantage is there for IM. Lanreotide is another newer drug which can be given as a subcutaneous injection 120 milligram once every 4 weeks. Tilotristat is another drug which can also be given in carcinoid syndrome. So these are the routine treatment available. Most of these drugs are available in our country. Now other treatment options, like we know that it's a tumor, so we have to resect the tumor. So carcinoid tumors are most of these carcinoid tumors require an excision of the lesion. That is very important. And if there is a metastasis also, there also we have to go for either surgery or chemotherapeutic drugs can be tried. Now this is a flow chart how to go ahead with the investigation and management. We already discussed that, but main thing is surgical resection. If you have a tumor, surgical resection is the most important, or you can go for drugs like uh, tilotristat and ondansetron can be given. And the one of the newer drugs is interferon alpha and peptide receptor radionuclide therapy is another newer treatment that is used for refractory diseases. So we have discussed about one of the important problem in lungs or stomach, wherever it is. These type of tumors can produce compressive lesions, but these carcinoid tumors can release some amount of hormones. These hormones can produce tachycardia, palpitation, hypotension, wheezing, flushing, all these things. But treatment is mainly resection of the tumor. Octreotide can be helpful as a medical therapy. Thank you.